take a look at the country's COVID-19 situation. I want to take an update from the Ghana Health Service platform. So there you have it. Our new cases, 702. This is as of 13th of February, 702. Those are the new cases we're looking at. But the active cases as we speak, 7,866. So the numbers are obviously coming down there, but it's not the same when it comes to the number of deaths that have been recorded since the pandemic broke. Deaths 561. 561. The number of deaths keep increasing, even though the infection rates or the number of active cases have decreased somewhat. But in total, 77,748 cases have been recorded here in Ghana since March of last year. But this is how it looks like now. Now, the active people, as in the people who are right now living with COVID-19 or are being treated for COVID-19, are 7,866. But unfortunately for us, we've lost 561 of them. Well, it's not all gloomy. If you look at the recoveries there, we have 69,321 out of the 77,748. These people have recovered. Let's keep taking care of ourselves. Subsequently, we'll tell you what the situation is in Germany, which is introducing stricter restrictions. But the Noguchi Memorial Institute has introduced a new system for the processing of samples to ensure efficiency and quick delivery. Director of the Noguchi Institute, Professor Kwabena Bosompem, said the new system introduced cuts off significantly time-consuming processes that have bedeviled them in the past.
Those samples will go to the laboratory, and our people will sit down and take paper and start writing where every sample is going to be. And that itself is taking time. And then when they finish writing it, they'll take it to the experimental hood and then put the samples into the plates according to the order. But this time, the machine has done this one for them. So all that they do is to take this sheet and put the samples. And once they have put the samples, the next thing is that they have to go to the PCR machine, which is like this one, and key in A1 is 210211, then A2, key in each one. That's again taking a lot of time. But this time, this computer is communicating straight to the PCR machine.
The LIS.
Through the LIS, that this is your sample placement. So all that the laboratory technologists or the testing person has to do is to put the plate in the machine. And then it does the analysis. So you can see how much time is cut off. Let's say today in the morning, we'll run the PCRs, let's say around 10 or 11. If you come after 11, your sample will be run in the afternoon batch. Okay. Already that is shifting your frame to almost a day. So it was like 6 to 8 hours, then the results will come. Now with this one, it's going to cut down drastically to maybe 3 to 4 or 5 hours. Okay. So you're taking several hours off. Okay. And if things are running, in batches like that, you end up saving a whole lot over a period. It will be accumulating into thousands of samples.
Well, Dr. Bosompem also says the new system makes it impossible to falsify results, which of course has become an issue since testing began.
Specifically, let's say the turnaround time previously, let's say it's about 8 hours. So you come in the morning, you are tested, and you can get your results maybe in the evening. Now, if you are tested in the morning, you can get your result by midday, that kind of thing. So the effect is huge. And then apart from that, the LIS is also, because of the way it has been automated, it is cutting off all the errors. No more errors, and it's also removing human intervention, and nobody can change the data. The information, if one is tested and the one person is positive or negative, nobody can change it. And even if somebody with higher authority is able to, can have an access to change. But when you change it, the computer system records everything you have done, in the sense that that information that is recorded can never be erased. So should there be any issue, if you go in to do any tampering with the data, your ID and your name and everything is recorded against what you did. So anytime that it is cross-checked, it will be there clearly that this person did this at this time. Every record is in the system, and that cannot be deleted. So really, this is one way also that the LIS system is going to more accuracy. It is also going to enhance our ability to store the samples, to package the results, ability to retrieve samples, ability to store data and to retrieve the data. So really, it is a comprehensive thing that is adding on to the excellence for testing.